Tiagabine is an antiepileptic used to treat partial seizures. In this video, let's find. What is Tiagabine? What is Tiagabine used for? Contraindication. What are the side effects of taking Tiagabine? How does Tiagabine work? How to use Tiagabine? What is Tiagabine? Tiagabine is an anticonvulsant medication produced by cephalon that is used in the treatment of epilepsy. The drug is also used off-label in the treatment of anxiety disorders and panic disorder. What is Tiagabine used for? For the treatment of partial seizures. Contraindication. Gabitril is contraindicated in patients who have demonstrated hypersensitivity to the drug or its ingredients. Side effects. The most common side effect of Tiagabine is dizziness. Other side effects that have been observed with a rate of statistical significance relative to placebo include asthenia, somnolence, nervousness, memory impairment, tremor, headache, diarrhea, and depression. Adverse effects such as confusion, aphasia, difficulty speaking clearly, stuttering, and paresthesia, a tingling sensation in the body's extremities, particularly the hands and fingers, may occur at higher dosages of the drug, e.g., over 8 mg per day. Pharmacodynamic. Tiagabine is used primarily as an anticonvulsant for the adjunctive treatment of epilepsy. The precise mechanism by which Tiagabine exerts its anti-seizure effect is unknown, although it is believed to be related to its ability to enhance the activity of gamma-aminobutyric acid, GABA, the main-inhibitory neurotransmitter in the central nervous system. Tiagabine binds to recognition sites associated with the GABA uptake carrier. It is thought that, by this action, Tiagabine blocks GABA uptake into presynaptic neurons, permitting more GABA to be available for receptor binding on the surfaces of postsynaptic cells. Mechanism of action. Though the exact mechanism by which Tiagabine exerts its effect on the human body is unknown, it does appear to operate as a selective GABA reuptake inhibitor. Half-life: 7 to 9 hours. Dose: partial seizures with hepatic enzyme-inducing anticonvulsants. Initial: 4 mg per day PO for 1 week. Titrate weekly by 4 to 8 mg, not to exceed 56 mg per day, divided Q8-12 HR. Partial seizures, without hepatic enzyme-inducing anticonvulsants. 12 to 22 mg/day PO, divided Q8-12 HR. Safety advice. Gabitril is listed in pregnancy category C. This means that caution is advised, but the benefits of the medicine may outweigh the potential risks. Studies in animals have shown some harm to the baby, but there haven't been any good studies of results in women. That's all the information about Tiagabine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.